So we are talking about why is this test performed. Okay. So here it represents an average blood glucose level over the previous 100 days, not only 100, even about 120 days. That's what. So we are getting average blood glucose value. So that is another important things. However, it does not replace the need for heme blood glucose monitoring on a daily basis. That's what we are going to prefer HbA1c. So HbA1c measures how much glucose is stored to the hemoglobin in our blood. So that test give us information what your average blood glucose level has been for past not only 2 to 3 months, but also 3 to 4 months. About we can call it as a 3 months, plus minus 3 months. That is about 3 months. So HbA1c results is a given as a percentage figure. By monitoring your HbA1c level regularly, you can see if your diabetes controls is improving or deteriorating. That means this will give a prognostic value of diabetes, whether it is a good progress or bad progress. So according, if there is a good progress, so we have to maintain that lifestyle. If it is a bad progress, we have to change our lifestyle. So that value of HbA1c give us clear-cut picture. It is always important to know your most recent HbA1c level. If your result is higher than normal, the chances of developing diabetes complications are going to increase. If your result is lower than normal, the chances of developing diabetes, so complications are decreased. That means we are going to maintain, so we should able to maintain the HbA1c within the narrow range. If the value is normal, so what happens? If the value is lower than normal, the complication is going to be decreased. There is a less chances. If the value is upper limit or higher than normal, so complications, as we already discussed during the HbA1c, during the diabetes mellitus class. So there are lots of complications. As I already told you, diabetes is nothing but the condition, clinical conditions. If it is uncontrolled, it becomes syndrome. That means there is a group of complications, group of disease will arise. That's what. So our main intention is how to maintain HbA1c within the narrow range. So this is the reference interval, which is recommended by American Diabetic Association criteria. You can also call it as a ADA criteria. So normal percentage value is 4.5 to 5.6%. So our target should be below 5.6. If the individual having the value 5.7 to 6.4%, that means the person is pre-diabetic. If we are not going to maintain the healthy lifestyle and dietary modifications, so there is a higher chances for the development of diabetes. If the more than 6.5%, the individual is diabetic. If the value is 6.6 to 7%, adequate control. If the value is 7 to 8%, inadequate control, that is poor control. If the value is more than 9%, that is very poor control. So worsening condition, and there is a lots of complications will arise. So our target should be, we have to maintain our HbA1c within the narrow range. That means below 5.6%. We have to recommended that one. If the person is in pre-diabetic zone, the value is 5.7 to 6.4%. So they have to follow their healthy lifestyle through dietary modifications, through physical activity, at least 20 days. If they'll maintain that lifestyle at least 20 days, so you will get the value, the percent decreased, 1% is going to decreased. So if the value is going to decrease, the way we have to continue our lifestyle as it is. So the person is going to revert into the normal. If the person is not going to maintain that, then what happens? The pre-diabetes is going to develop into the diabetes. So keep in your mind, it will take a 20 days. So what are the methods for the measurement of HbA1c? There are lots of methods in normal laboratories. So nowadays, HbA1c, high performance liquid chromatography. Those who don't know about HpA1c, I'll send you a video. You can go through that. So this is nothing but the chromatography, advanced chromatography technique. Through that, we are going to measure HbA1c. And this is the one of the best method for the lots of, there is a uh, biochemical test, and there is a lots of analyte we can going to measure, and mainly that HPLC technique is going to use in pharmaceutical industries for the separation of analytes. In our diagnostic also, commonly we are going to use for the measurement of HbA1c. And there is a immunoassay technique, we can also called as a immunoassay technique that these days in our lab, CLIA and ECLIA, chemiluminescence immunoassay technique, electrochemiluminescence immunoassay technique. You can go through that topic in my YouTube channel. I had already kept that video in my channel. I'll share you. You can go through the CLIA and ECLIA technique. This is the advanced technique in our lab where that multi parameters we can proceed from that techniques. So that is the advanced technique that is comes under the immunoassay technique. And there is enzymatic technique is there, electrophoresis, capillary electrophoresis is there, affinity chromatography. Among all these, commonly we are going to perform HPLC, and immunoassay technique is commonly we are going to use. So these are the methods, and these are the principle and advantage and disadvantage. You can go through this. So this is the methods we are going to prefer in our lab. And HPLC, high performance liquid chromatography, depends on molecular weight of the solute, water solubility of the solute, polarity of the solute, ionic and non-ionic character of the solute. Based on that, they are going to measure, they are going to separate the molecules. So here, simple preparation, we are going to take whole blood, and that is anticoagulated blood. And we are going to use the HbA1c calibrators. So commercially available is there, the calibrator. And lipocheck controls also we are going to do for the accuracy of the results, for the precise value. and whole blood sample, that is nothing but the EDTA sample. And maintenance should be needed in daily basis, otherwise we'll get the fluctuate value. So all these are maintenance technique. And nowadays point of care instrument is available, and NICOCAR and all these. And this is the instrument you can see here for the HbA1c purpose. So in 2010, consensus statement on the worldwide standardization of the HbA1c measurement. So HbA1c test results should be standardized worldwide. The IFCC represents, IFCC means International Federation of Clinical Chemistry. They have a standard reference. So we are going to follow IFCC and ADML, Association of Diagnostic and Laboratory Medicine. So these two association, these two professional platform are playing an important vital role in laboratory medicine. So, and these are the advantages of HbA1c. Index of long-term control over the 120 days, and not a snapshot like a, and can be done in any time. You can do anytime. Useful index for clinical trials and all these things. So we can go through that, and there is a limitations. And sometimes we are getting false positive value. So there are factors which influence the HbA1c value, like acute hyperglycemia, severe anemia, gestational diabetes, and lifespan of RBC, abnormal hemoglobin like sickle cell hemoglobin and HbC, and serum populations if we are getting increased triglycerides, and on the method of estimation, which type of method you are going to prefer. So these factors will influence our HbA1c value. So causes of high and low HbA1c, newly diagnosed diabetes mellitus, we are getting high value, uncontrolled diabetes mellitus, non-diabetic hyperglycemia like obesity, acromegaly, Cushing syndrome, splenectomy, alcoholism. So in these all these conditions we are getting high HbA1c. And these are the conditions: chronic blood loss, chronic renal failure, hemolytic anemia, that is hemoglobinopathies, congenital acquired hemolytic anemia. In all these conditions we are getting low HbA1c. So these are the conditions where causing inappropriate high or low HbA1c. You can see here inappropriate low HbA1c, these are the conditions. Whereas high HbA1c, these are the conditions: iron deficiency, vitamin B12 deficiency, alcoholism, uremia, hyperbilirubinemia, and few drugs if you are consuming. So there is a chances of high HbA1c. And variable effect on HbA1c, fetal hemoglobin, methemoglobin, certain hemoglobinopathies. So these are the variables. So this is the blood glucose monitoring. So in type 2 diabetes mellitus, the frequency will be monthly. Fasting and PP, type 1 diabetes mellitus, 4 to 6 times initially established. So these are the pattern for the blood glucose monitoring. So correlation. If we'll correlate with the blood glucose, if the HbA1c is 5, that means the blood glucose is 80.5 according to this formula. That means according to the recent blood glucose, we can conclude as a percentage of hemoglobin. But the percentage of HbA1c, according to this formula, I can calculate how much glucose is there. If the value is 9, the blood glucose is 213.7. If the hemoglobin HbA1c is 11, it's 280.3. That is the mean blood glucose percentage, average blood glucose. So this is the confirmation of diagnosis of diabetes. And as I already told you that modern GTT, so we have to go for the fasting blood glucose and postprandial blood glucose. And the fasting should be 126. Nowadays, fasting is quite modified. This is not 140, this is 126 mg per deciliter. If the fasting is more than 126 mg per deciliter and postprandial is more than 200 mg per deciliter, so that confirms the diabetes. So if we are getting altered HbA1c, we have to record HbA1c regularly. And then according to that, we have to maintain our healthy lifestyle and well-beings. So this is the point you have to keep in your mind. So this is all about the HbA1c. So now